Jack.
Yeah, he hasn't been on yet.
All right, welcome to the Kent County Lead Task Force. We might still be waiting on a couple other members, but we might as well get started. Let's see here. On our agenda, the first item is welcome and introductions. I'm Emily Breeby. I am a county commissioner, and I represent the 10th District, which is Gaines Township in Caledonia. And the other folks here on our board. And why don't we start down on the end? Introduce yourself.
Cameron Van Weingarten, manager for Plainfield Township.
Rebecca Reinbrandt, the Director of Community Services for the City of Wyoming.
Hi, I'm Matthew Van Zetten. I'm the Interim Director of the Kent County Community Development Department.
Hi, I'm Shannon Wilson. I serve as Executive Director of the African American Health Institute.
I am Paul Hahn. I work with the Healthy Homes Coalition of West Michigan.
Good afternoon. I'm Adam London. I'm Health Officer for Kent County and Director of the Kent County Health Department.
Sunita Lidward, City Commissioner for the City of Grand Rapids.
Carol Hennessy, I'm a Kent County Commissioner and Minority Party Vice Chair.
Dan Corndike, Kent County Commissioner of District 18, which is a big chunk of northeast Grand Rapids and a little bit of southwest Plainfield Township.
I'm Connie Bohach. I'm the Managing Director of Community Services for the City of Grand Rapids.
Cheryl Clements, Health Department.
I'm Joan Heiser-Honig. I'm the consultant who will write the report when the task force finishes its work.
Thank you all very much. Well, let's be a number of members in our audience today. I just wanted to move on to the next item, which is public comment. Is there anyone from the public who'd like to speak? All right, seeing none. Our next item is a presentation by Lieutenant Governor Brian Calley. And I just wanted to welcome him and say a couple things here. He's been committed to implementing strategies to build the best Michigan for everyone, including those with mental illness, developmental disabilities, and addiction issues. He's also chaired the Child Lead Poisoning Elimination Board, and which has kind of created a roadmap and kind of has helped our task force along here too, suggestions and ideas. And Lieutenant Governor Calley is here today to present on the Governor's Lead Task Force recommendations, the state plans and objectives, and how Kent County can be a partner. We'd love to hear from him, and at the end we'll also have an opportunity to ask any questions. So welcome, Lieutenant Governor Calley.
Well, thanks for the invitation. It's great to be back in Grand Rapids in Kent County. And I thought what I'd do is I'd start with kind of a higher level discussion about the type of change that we are hoping to see in the response to environmental contaminant of lead, which exists in so many places, so many living spaces across our state and certainly across the country as well. Also a special acknowledgement to Paul Hahn, who's been so engaged at the state level and was a very important expert resource, and so you've tapped into somebody who really knows this stuff, and hopefully it will be a great bridge between this community and the things that are happening at the state level. At a kind of the 10,000 foot level, what we're trying to accomplish is to move our system from a reactive system to a proactive system. So in the past, the way that the response to exposure to lead has been dealt with is that normally it would show up in somebody's blood in a blood test, and then there would be some sort of a response depending on whatever the community's local standards and capacities are, and that response would lead to a particular set of actions. The problem is for that particular person, it's already too late to prevent the negative aspects of being exposed to lead. And so trying to move our whole system to one that is focused more on primary prevention, that ended up being what I consider the hallmark of the lead poisoning elimination task force. And as you can tell by the name, we didn't really want to think small. It's not the Childhood Lead Poisoning Board, it's Elimination Board. And we understood right from the onset that when it comes to eliminating this contaminant from every corner of our state, that this is a really tall order. This is a task that there's no easy way and no cheap way to deal with, but it's going to take disciplined, multi-level strategies from the local all the way up through to partnerships at the federal level in order to make this happen. And so while a set of recommendations which still try to increase and to expand the capacity for secondary prevention, there's been some sort of exposure, we know about it, and then how do we deal with it? that still has to be an important part of the plan, and capacity building has been a major challenge in nearly every community, and I think one that you've faced here as well. Even when you know about a hazard, having the size of the system that you need to identify the scope of it, and then the partners to actually eliminate that, and the resources to eliminate that contaminant is something that a lot of communities are struggling with. So one of the recommendations that got a lot of attention was the idea of going back to universal testing of young children. There was a time when that was the standard operating procedure. That was something that just happened, and we had a better sense for what the overall situation was and where the risks were. And it really, there's a lot of strong and important information that came from that system. But as the overall lead contamination levels came down after changes in the 70s and the 80s, this more or less, I don't want to say total, for a lot of you, of course, around this table, it didn't fall off the radar screen, but for a lot of communities, it really hadn't been of the prominent level of importance in terms of response and attention for a long time, because compared to the past, our contamination levels and lead poisoning levels are much, much lower than they were when I'm 40 years old. So when I was growing up, that what we consider to be an emergency today would have been much more common back then. And so it had kind of fallen off the radar screen in terms of the public health need and the requirements of it. And until we had the flimses, and it really did not just raise awareness, but also it's led to action on a lot of different levels. And it is my hope that the awareness and the determination that came from that will result in communities pulling together and partnering with the state and the federal government in order to eliminate this very old contaminant from our lives entirely. And unfortunately, it's going to require an address by address, house by house type response. There isn't an easy across the board way to do it. Things like changing the requirements in construction materials and paint and in fuel, that had a profound impact across the board for everybody, but we're really to a point now where it's just getting rid of the old contamination that exists in so much of our housing stock around the state, including in what I would just caution everybody not to consider that to be the only problem. While that has received, of course, a lot of attention in the last few years, the vast majority of lead poisoning cases that we see around the state and around the country still come from dust and paint and soil. And so we really do have to make sure that we're taking a not just proactive, but a comprehensive in elimination. So when it comes to that shift from secondary prevention, there's been some sort of exposure, and so there's a reaction to that exposure in shifting to primary prevention. We came to the determination that a predictive data, a data system that has a predictive ability to identify high-risk areas is important. Think about all the different things that different nonprofits and government agencies at different levels at the county and city and assessment information. You've got all this information and data out there. And it probably has all the things that we need in order to fairly accurately predict where there are likely to be problems. And yet that data doesn't really exist in one system anywhere to where it can be analyzed and we can get to the primary prevention. In other words, we don't wait for a blood to show lead in it, but instead we have the type of system that says houses on this street in this city are at a really high risk for contamination, and so we need to proactively go to the people in those houses and work with them on managing those risks or eliminating those risks. And that's part of, and while it didn't receive a lot of attention, that I consider that to be one of the most important aspects of the work that was done by the Lead Poisoning Elimination Board, is to start the process of gathering all the data that we have available and figuring out how we can use that to predict where we need to proactively remove the exposure and the risks. There are other ways that we can be proactive as well, and some of that isn't even going to require new laws or new ordinances at the local level, but stepped up enforcement capacity. There are cities around the state that have very good ordinances when it comes to landlord requirements, for example, in terms of managing these risks and eliminating the lead exposure. But in many cases, the feedback that we heard was that the resources to effectively enforce those ordinances are fairly not sized right to what would be needed in order to really protect the public. We know of some cases where there are certain addresses over time where families are moving in and out of houses where there are multiple cases. Every few years there's another lead poisoning case. So having the tools, and again, we're looking at potential statutory changes at the state level, but certainly ordinance level tools to make sure that these properties are safe is the thing that I like about that approach is that it takes advantage, or it could take advantage, of things that are already naturally happening out there in our economy. Families are moving in and out of houses and apartments and so forth. And if we had a good system for predicting where there were problems, you could use that in-between time when you don't have somebody in a property or before a property is leased to the house is safe. And you could break this cycle of multiple families moving in and out of a house that happens to have these types of contaminants and exposures in it. Now, resources have always been a challenge, not just in this area, but naturally with a lot of the work that we try to do. There seems to be a struggle, no matter what area of public service you're talking about, in finding the resources. But we have received a very significant multi-year grant award from Medicaid that I think will really help us to take it to the next level. And some of that money is specifically earmarked for certain communities in our state, Detroit and Flint, including from the federal government, including starting up these data systems, building and testing those systems that we could then deploy later on statewide. But there is, just announced today, out of those federal resources, a grant $6 million that will be awarded to probably around five or six communities around the state. So we're talking about a significant grant opportunity here that has a maximum of a $1.5 million award per community. And that includes some of the things, the community education, prevention, and the response to lead poisoning, but also building data systems. And there's a whole list of things that qualify for this money. But I can tell you that while it's not necessarily a requirement to qualify for the grant, that communities that have comprehensive plans and can show how this grant award would fit into those comprehensive plans, I think we'll be in a good position because the sustainability of these efforts is really important. And so getting things started or getting things running and partnering with a community that has a strong plan is something I'm really excited about. So as these resources are always looking for more, we actually had some also appropriated in the state budget that the governor just signed as well for implementation of the goals of the Lead Poisoning Elimination Board. He put that together with the federal resources. I just think we're in a better position to make a difference in the next few years than we have been for a long time. So it's a really important area, and I want to thank each of you for spending the time on and making this a priority here in Grand Rapids. You just have so many outstanding that are that are thinking ahead about how we can make this the best place for people to live and to grow up, and to eliminate these risks and aggressively take care of them. So thank you for your service there, and I'd be happy to take some questions. And again, if I didn't make it clear, to invite you or ask you to please work with whichever agency ends up making or submitting the grant request to aggressively go after the CHIP dollars, the grant process or award, or the grant RFP request that was put out today. It is opportunities for grants at this size don't come along every day, and I think it could really kickstart the efforts that you have here.
Great, thank you so much, and that's definitely an exciting opportunity. The grant money that's available, I can guarantee that we'll be taking a look into that and seeing how we can use that for our community and coming up with a plan. So, thank you. Then I'd like for questions. If anybody has questions, thoughts. Go for it.
So, first of all, Lieutenant Governor, I want to thank you for coming today, and I want to thank you for being a public health champion on a number of issues, autism and substance abuse and the issue of lead. You've really been a leader, and we're appreciative of that. Aside from applying for the CHIP grant, is there an opportunity that you see that you would strongly recommend that counties or local units of government get involved with in order to deal with this issue?
Well, there's a couple of different areas that I think organization can make a really big difference on, and don't necessarily require substantial additional resources, although I understand time is money, and so staff time is resources. But the working with the healthcare professionals to get this higher up on the priority list, like we do expect that if a child is on Medicaid, between that they have lead blood tests. But it's not the sort of thing that commonly happens by all pediatricians. And so an effort to try and get that back in the normal routine of the, like it used to be in pediatrician offices would go a long way in a very important piece of information, which is where ongoing exposure is happening. Because you wouldn't necessarily know when, in fact, you really wouldn't know, absent a blood test in most cases, that there was an exposure, and pediatricians are really front line in this. And so an organized effort to try and partner with the practices in this area in order to elevate that as something that is commonly done in a normal checkup process, I think would go a long way. Another area is ordinance review. So what ordinances do you have, particularly with rentals? When you have that are moving in and out of rental properties, and the property may or may not be well maintained, and the maintenance level of a property is a very important determinant factor or predictive factor when it comes to whether lead contamination is being released or not. And so, what tools you might already have in your toolbox under current ordinances, or considering what type of enforcement would be appropriate is another thing that I would recommend. And then part of it is just helping people to understand what the things are that they can do to minimize risk where it exists. And some of the things are fairly simple. They might require some resources. Fresh paint, for example, is something that at least can protect from ongoing exposure. But something simple like removing your shoes before you go into the house. If you have a house that is of the age where the outside was likely to have been painted with lead paint in the past, just weather and rain and chips and so forth, it gets into the soil around the house. So a well-seeded lawn is another to protect from exposure or contaminants that might exist there. These are things that I think a lot of people, if they understood what the risks were, could could potentially mitigate them, or kind of take it upon themselves to take care of it. But I don't think most realize that where the contamination risks exist and what some of the things can be that protect from it. The final thing that I'll say is that it's one of the things that we're looking around, like what are the other things that naturally are happening under the normal course of business with the state, and how could that potentially be married up with the efforts to try and eliminate lead poisoning and contamination. So just one kind of classic example I'll give you is that there are energy efficiency programs, and some of them through state programs. There are some that are through utilities. Well, a big part of that is window efficiency. Well, windows are also one of the main culprits of lead poisoning. And so maybe it's possible to try and, if we had a good predictive model of where lead poisoning was, and we have resources for energy efficiency and trying to make homes more energy efficient, then maybe those two data points and those two goals could be put together to where you could an existing program, an existing resource, and use it to take care of a different problem, or to take care of two problems at one time. So looking for those kinds of opportunities, those kinds of partnerships, essentially acting and looking and getting results that are bigger than what anything would be on its own. So some suggestions, but really getting people together to talk about it, and the different players in the community, and making sure that people know what you're doing, what the capacities are, and how you can help each other. That goes a long way. So I think even the fact to put this group together and are thinking ahead about this will put you in a better position than most.
Yeah, thank you for those comments. Now, as you can probably imagine, early on, many of our concerns were because of water, because of the narrative of Flint and elsewhere. We have a high level of confidence in the safety of our drinking water supply here in Kent County, and we've heard from experts who can testify to the integrity of our water supply here. We've also learned a great deal from a number of experts about many of the things that you have indicated that people have within their own abilities to limit their exposures. The challenge, one of the challenges we're going to face going forward is how do we communicate that effectively to our citizens here in Kent County, throughout West Michigan, probably statewide. And I know that was one of the recommendations within the report was advocacy and outreach to citizens, empowering them with the things that they have within their ability to change. Do you anticipate that there will be an effort from the state to start to take on some of that work as well?
That is in the CHIP grant that was put out today. That is one of the qualified activities for a plan. And I mean, there's no easy way to do this. I can tell you from personal experience, having been kind of in the business of talking with, meeting with people, that getting the word out, it's a lot of hard work and going to where people are. So I would encourage against relying too much on a lot of great information on a website somewhere that nobody visits, and instead having the type of capacity to go where people are, particularly people in zip codes that are experiencing higher rates of lead poisoning, to be as proactive and to really focus on those areas that appear to have the highest risk. And then the messenger is important too. There's one thing that I've really learned is that it's one thing to have information, but that good information needs to come from a trusted source. And in some cases, particularly if you have language barriers, for example, that the trusted source for one group of people might look very different than a different group of people. So we have to think ahead about who are the community leaders, who are those trusted voices that we could really invest in empowering them with information and then help support delivering the message in a more effective and robust way. Now, all of that, and this is really, really important work. I just want to make sure, though, that we understand that elimination of the contamination should still be the underlying goal behind everything that we do. So when so mitigation of the risks that are out there is a good short-term response to it. And the great thing is there are so many things that most people can do things as simple as regularly washing toys that kids play with that are kind of on the floor house, and taking your shoes off before you go in the house, and washing your hands before eating dinner. Those are the sorts of things that make a really big difference if you have a house that has had lead paint in it over the course of the past. But ultimately, as long as that contaminant is in that house, sooner or later it poses another risk. Even if you put fresh paint on the wall, but that only lasts so long. So I just want to make sure that we, as we deal with our current issues and our current exposure, that we don't lose sight of the goal of elimination of the risk altogether. And that is it's an intimidating goal, because it's an enormous task, because these exposures and these risks exist almost everywhere. And it will take a long time to happen, but it's worth it. So that's where I want to make sure that we do all of the mitigation work, and we do all the responsive work that we can when we know that there's a problem. But eliminating it completely, I hope, will be a goal that communities adopt everywhere, with the hope that in the next generation that a group like this wouldn't even be necessary, because we just eliminated it completely.
Thank you.
Again, hi. Thanks so much for coming today. I've really appreciated the message in this report about primary prevention versus secondary prevention, and just want to congratulate our County Board of Commissioners, because I'm the program manager for their prevention initiative, which really invests and has been since 2003 in primary prevention for early childhood. And when I think about the impacts of lead, there's so much that can happen with early childhood in children, and we see the impacts then throughout education and potentially in the correctional system, and on and on. So when you talk about data in this report, and just talking about weatherization and utility payments, things that government pays right now, I see lots of opportunities to use data warehouses that the state already has built in, and be able to pull data to do that big data thing, and be able to target geographies to really reach out and then do the primary remediation, elimination that you talk about. But that really requires some analytical skills from the state to help us do that work. And then it seems like it also requires some variances or waivers on policy, because so much of our policy is based on secondary, like our CDBG funds or our lead grants or things like that. So I guess comment, question, all of that is one of the biggest things I see that the state can really help us with is using existing data in that data warehouse to really pinpoint our interventions more effectively, because some of the work that get the lead out is incredible that we've done and locally, but yet we know we have areas in parts of Kent County where the lead exposures are just as high as they are higher than the city of Flint, right, with their water crisis, and it's paint, dust, things like that. So I guess I would just encourage us all, as we think about the great recommendations in this report, to see that state-local partnership that's necessary, so that we can use the data that's already out there to allow us, who are in the public sector, like CDBG people or others, to continue to work towards pinpointing where to put our interventions, and then also helping around some of the existing regulations that the money has, so that we can do what this talks about, which is the primary work. So I don't know if you have any comments or thoughts on that.
Yeah, I do. I believe that we do have the majority of the information or data somewhere at different levels of government that we need in order to have a very accurate predictive model on where the problems are. And the thing is, while we think of in terms of zip codes, it's an interesting work and very important work that is being done in the city of Detroit by Wayne State, and another one of our task force members. That you can look at one neighborhood and you can have one street that has no reported lead poisoning, and literally the next street over has an unusually high level. And so the houses kind of look the same. They were built at around time period. So what's really the difference in it? And it could be just that maybe one contractor used a certain type of materials when they built most of the houses on this street, and another one built the houses on this street. I mean, but that type of information, in terms of street by street and house by houses, is important in understanding what are the factors that lead to a higher incidence of lead poisoning, and then using that to be proactive about it. Where we run into the difficult problems to deal with tend to be with medical privacy. So when it comes to a blood test, for example, that's a medical record, and so as we start talking about individual parcels, and those parcels are tied to medical test results, that's the part that we've got to figure out how to protect that information but still use it in our system. So that is what we're working, I mean, that's what the effort is centered around, is how do we get the information that's already out there, whether it's assessment information in terms of the age of the house and the condition of the house, because that is one of the factors in the public assessing information. Both would be good predictive bits of information, but then also the history of the property and who knows what else. But you've got all of this data out there at different levels, and so I don't look at this as an exercise of finding a lot of new data as much as it is how do we put the data that we have already together, protect the privacy where it needs to be, and then use it to be proactive with our abatement efforts.
Yes, again, thank you for being here with us. I'm curious to know if the task force made recommendations, financial recommendations for the state's FY17 budget, that then the local community, I think it was great that you, the CHIP dollars, and thank you for stating that we will make a commitment to take a look at that and see if it makes sense for us to apply. But I'm more curious about what is the state's commitment financially to addressing, or as you put it, eliminating lead across the state.
So every single recommendation potentially fits somewhere in state government, or at least a partnership that could affect state government and another level of government. So in terms of just an appropriation for the Lead Poisoning Elimination Board, I think that we ended up getting a little over $1 million, 1.2 or $1.3 million in this budget. So that's not, when it comes to just like the actual abatement of a house or something like that, that's not what those resources would likely go toward. Although building the systems and this work of trying to take what we have and turn it into something that everybody could use, I think is a more likely, although I don't want to get ahead of the group as they kind of set out their priorities, but I think it's a more likely project that could be handled by that level of resources. But in terms of the rest of it, I think there's other areas. For example, in the Department of Health and Human Services, at the Medicaid budget itself, if we are successful in getting pediatricians to get the blood test done on children of certain ages, then that's going to be a part of an existing line item in state government. So it wouldn't be specifically called out for this effort, but it would be used to fulfill the goals. So my experience, though, has been that when we're starting something new, particularly something as aggressive as this report is, so the comprehensive of the Childhood Lead Poisoning Elimination Board, the comprehensive nature of the recommendations they're striking, and they can be somewhat intimidating when you think of what it would really take to eliminate lead poisoning everywhere in our state. This is a huge undertaking. There are a couple of different ways, though, that we could approach it that I think will be more successful in getting more specified state appropriated resources for the effort. Either we break it down into bite-sized pieces that on their own don't seem intimidating. If I were to go and say I think that overall this is a multi-billion-dollar effort, well, it's something you can't do in a short period of time. But if we were to say for this year and next year and next year, here are the most important steps that we can take to start moving down this road of eliminating lead poisoning where. So prioritizing and putting the most important steps first and getting some wins together on making some of the statutory changes in the building the systems, I think that's a good strategy to use to take what's in the report and get it implemented. The other thing that I've noticed, though, is that successful local community efforts really do, like things that you can call pilots, even if they're very comprehensive, and it might be intimidating on a statewide level to think, yeah, we're going to turn a switch and make all that happen across the entire state. But when communities come together and have plans, and it can be done as a pilot, that's the sort of thing where I've noticed that whether we're talking about the diversion efforts and mental health efforts and things where these are really big statewide problems, but we have more success if we can start with a pilot, show success, and then expand it from there. Those who make decisions in our system really do seem to favor that. Show me a good plan, show me some good results from that plan, and then we'll talk about making it bigger. So I think you're well suited for that here, particularly because this is an area that there are areas within Kent County, as was mentioned, that have high lead poisoning rates compared to other places. So you've got an urgent need here, but you've also got it has a great track record of taking on tough problems and making really great things happen. And so when you have the plan, you have some local buy-in to the plan, and you're looking for a partnership with the state. I think that's just a great approach. And I'd love to work right there with you I know several of you, some of you I don't know, but by reputation, I know that Kent County is a remarkable place. And people work here together in a way that really makes me proud to be from West Michigan. And I couldn't say enough about Paul Hahn. I think he's the kind of expert resource that most communities don't have. So that's just to have the kind of boots on the ground type community organization with that level of knowledge and professionalism is something that I really think puts you in a position to make a bigger difference in a shorter period of time.
I had a secondary question. These meetings are recorded so that the public can see some of the information that's being shared with us. I know many of us have reviewed the report, but could you highlight some elements from the report so that on record the public can hear a little bit about what your findings were and some of the recommendations that maybe would speak to our community? I know you've kind of listed some of those throughout your presentation, but if there's anything that may have been missing that you think the public should hear.
Yeah, well, the overarching goal is to make sure that we don't limit ourselves to primary or to secondary prevention, that we really make sure that our system is, the secondary prevention work that we do is oriented toward making sure that it turns into primary prevention for somebody else. So the idea of elimination. But we looked at things that really hadn't been a part of what had been done in the past. So I talked about ordinances, I talked in rental properties, I talked in enforcement, and in blood tests, and in the responsiveness to that. There was also early childhood education and early executive of the brain. That type of work that happens in early childhood education is a really important mitigant step that can be taken, and also nutrition. It's one of the things that often gets lost in the discussion is how important proper nutrition is. So if you have two people that have lead exposure, but one person has calcium and iron deficiencies and the other person doesn't, the one that has calcium and iron deficiencies is more at risk given the same exposure. Because your body doesn't necessarily know the difference between calcium and lead. So if your body, there's this thing in there and it's very dense, and so it will hold on to it if you have a deficiency in calcium. So proper nutrition is an important part of our overall protection of the community. And the thing is, calcium and iron and vitamin C is the third major nutrient that people need to mitigate this. But we need those things anyway. right? If our whole society had the proper amount of those, then we would generally be healthier anyway, and it is a protection against lead exposure. So there's the building of the data system was what I think it will be kind of a hallmark that comes out of it. The partnerships with the medical community and that responsiveness, higher enrollment rates in things like Great Start, and then having communities on the lookout for developmental delays and early on access and proactive approaches like that. Paul, what am I missing? Oh, actually, you know, one of the things we did spend some time on is the capacity for response. So you could go to any different community in our state, and you have certain results in blood tests, and different levels result in different types of responses, both with the intervention with the individual, when a home examination would be done to identify where the risk came from. In some places, the lead poisoning has to be above a certain threshold, and in other places, anything that would be classified by the medical community as being lead poisoning would be investigated. And those are local capacity issues. So we did talk a lot about capacity to respond in cases. That's just a flat-out resource issue for the most part. But then the other, when you turn that secondary prevention into primary prevention, where you're trying to mitigate to abate the contaminants in a particular household, we're also finding there aren't very many contractors that do that type of work. And so even if we did have even if we were just flush with all the resources to do all this work, we don't have enough people that physically do that kind of work out there. And so trying to build out that type of capacity, which would generally be a private sector credential and type of construction work, paying attention to what your local capacity is to deal with these issues is just as important as the rest of it, because you can put all the resources out there, and if you don't have contractors that do this type of work and can do it well, because there are a lot of risk involved in the time period where the abatement is happening. In fact, in Flint, for example, when it comes to removal of the water lines, so that's an ongoing process. What they're trying to do in a couple years, the city of Lansing spent 12 years doing, and removing all the lead service lines from the entire city. So it's a big undertaking, and there are risks while that construction is happening. So based on the water quality test, right now it meets the same water quality standards as everybody else. But as long as there's construction in the area, there's vibrations and so forth, we still recommend filters, not because the water quality is any different than anywhere else in the state, but because there are additional risks when the actual abatement work is happening. And that's true of the abatement work on the water lines, and it's true of the abatement work on the walls in the house. In fact, window and wall abatement work is a tremendous amount of risk. So you have to have contractors that know what they're doing, and there are certifications for this to get into this line. So that's I would definitely recommend that you think about your local capacity, or understand what your local capacity is to do the abatement work. And finally, one of the things, and it is one of the line items you can ask for resources for under the grant that I talked about earlier, is temporary relocation. So there are some cases, even if the contractor does everything that they're supposed to do, it's just really hard to contain lead during the abatement process itself. So if you have a family that has young children or a pregnant woman living in the household, maybe a temporary relocation while the abatement work is happening is the best approach, as opposed to trying to mitigate the person inside the house while it's happening. You know, these are all things, I mean, you get a sense, though, for how detailed and person-specific this work is. But that's really where we're at. All the big, broad policy changes, don't put lead into paint and don't use leaded gasoline, anymore. In the water fixtures, unfortunately, it was only since 2014 that lead was barred in those in faucets and things. But those are the big policy issues that will, over time, make a difference as housing stock turns over. But now it's really a matter of dealing by person and residence by residence. And in some cases, businesses and schools, too. We did a lot of work on schools in Flint on their water systems, and there was a lot of really old plumbing that needed to be replaced anyway, and so we were pretty aggressive on replacing that as well. So I wouldn't forget about all the places where kids are. So kids spend maybe most of their time in their house, but they spend time at grandma's house too, and they spend time at school. So understanding what the risks are in those places, daycare centers as well, very, very important aspects of this. So, and there's more than that too. I mean, it's really the report itself is, the scope of it is very comprehensive. That's why we spent the first few meetings of the permanent commission that is put together to implement these recommendations. We're really spent trying to prioritize what to do first, where to start, how do we get this thing rolling, so put it into the types of pieces that are implementable.
Dr. Fawcett?
Yes, thank you very much, Lieutenant Governor. I want to thank you for your time, commitment, as well as your insights. I've got two questions, and I'm going to lob the softball first. And that is, can you tell us about the timing of requirements for application for these CHIP dollars?
Well, it was just announced today, and I think it will be open for a couple of months, but let me get back to you on that. I don't know how long we have for grant application proposals, but I'll get that to you so you know exactly what it is. But it's I want to make sure that this community really does have whatever time needed to put together a great proposal for it, but I think that there is time.
Thank you. My second question might be more philosophical, and that is, what is the best avenue of really approaching some of the challenges that actually Matt had in? So when we bump into obstacles and barriers around policy and practice in terms of having access to data to allow us to create interventions, both within our efforts to address the issue of lead, but we have, for those of us that are involved in sort of multifaceted programming, we're running into some of the same things as it relates to mental health services as well.
Yeah.
So what's the best way? Is it working with, your local congressman, really approaching departments themselves? And maybe it's my own naivete, but I tell you what, I haven't found an effective way of navigating that process yet.
Yeah, and it's hard because because a lot of this stuff falls in administrative interpretation of rules, and who owns that interpretation is not always clear. It's one of the things that really has been frustrating over the course of this work and similar work that you had alluded to, is that it's not usually cut and dried, like here's the statute or regulation that needs to be changed. Now, in some cases, if it's HIPAA, then it's that's a very, and by the way, HIPAA is a very difficult. There's not a lot of exceptions to it, so that's one that is that you just have to figure out how to work with whatever you're doing. But I would rather see an approach, as opposed to saying here's a problem, is maybe kind of to the extent that you have people locally that deal with whatever that regulation or that restraint is on the data is, to the extent you have people that really understand that, to come up with a more specific request on use of data that is not currently allowed. In other words, okay, so we've got this to do. We'll be more effective if we had this piece of information. And to essentially make a proposal or a request. A lot of times, if it's healthcare related, it could go through the Department of Health and Human Services, and if it's a federal policy issue, then we've got great relationships at the department level to make those types of requests. But to rather than look at it like, this is a problem and it needs to be changed and how do we change it, maybe just say, we need that information, here's how we would use it, and then make a request to use it for those purposes. And then what we can try and do, both at the state or the federal level, and I would definitely volunteer to help to get it through to the federal level, to look for those types of, sometimes you get like a waiver. In fact, in a lot of cases, you can get a waiver. Things that seem pretty set in stone, and you say, but we've got this pretty specific request. Can we get a waiver from this requirement to use this for this purpose? And that's where I think probably our best bet is to have a specific proposal for the use of the data. And then we'll find out who controls the lock and key for that information, and then make the ask, and then that response will often give you who's in charge in terms of who could make that decision or what would have to change in order for that to happen. When it's a change in state statute, I'm not at all afraid of that. There are many cases where we've approached policy difficulties with changes in state statute. At the federal level, it's a little harder, more than a little harder, but it's still doable. And we have successfully received waivers on different federal programs to try innovative things here in Michigan, particularly in the healthcare space.
Typically, the waiver on the federal programs come when it's a policy or a guidance from that agency, because the statute requires congressional action. So to do it through something that's put in place through statute requires Congress to act on it. But anything that's a policy or interpretation of the statute, then that federal agency can grant the waivers. So, and those are much easier to come by than the statutory changes.
Yeah, no, getting something through Congress is a heavy lift, to be generous.
A lot easier to be done at the
But even at the administrative level, when you're pretty sure that it's an administrative action and they have the wherewithal to do it, usually the first answer is what statute says. But oftentimes I've found that statute is not very specific at that level, at the federal level, and it does leave a lot of leeway for administrative variance in administration. So sometimes sometimes you have to be satisfied, or not satisfied, but sometimes you have to be prepared to not accept your first no, because usually the answer at first is no. And then you have to dig and push a little more. You have to present, but you could, I know that you're here, but here's a way you could do it. Presenting solutions gives you a shot at it. Unfortunately, in a lot of cases, I suspect that it's actually not going to be state policy. That is the barrier to sharing information. It's going to be federal policy. But that doesn't mean that we can't go after making those changes. And the more specific we are with it and ask, and we can tell them exactly what we need the information for, how we're still going to comply with the statute with it, and the difference that'll make, then we got a shot at it. And please consider us partners on that.
Okay, very well, thank you.
Any other questions at all?
I'm curious, we didn't talk about this much at the board. We talked about funding plenty, but we didn't talk about a particular strategy, and I think Matthew's starting to touch on this a bit too, and that is, we do bear a cost for lead poisoning in other areas, and the challenge with lead poisoning is it's kind of all over the map. But do you see at this point in time opportunities to look at ways to tap those savings? The administration, is currently working on some social impact kinds of funding projects. Do you see any prospects here, or something that might resemble that, if not?
Yeah, and in those cases, it's a difference in the way that the state and government usually works, and there are other places you can see around the country. There are other places that have done some pretty cool, innovative things to create these partnerships and act and be bigger than what they could ever be on their own. So, I think really the missing link here is taking that concept and turning it into like a real thing, a real proposal. And having those, my experience has been that concepts only take you so far, and when you can present something and you have credible people behind whatever is being presented, that it's different. We want to try new. We want to, we want to have We want to draw down other type, we want to use state resources in a different way and empower the innovation of the local community. I just think that's really exciting work, and we'll probably get better innovation out of it than what we get out of our normal government programming. So, I would just invite you and this group to come up with something to kind of put it on the table, and give some of us policy members or policy people at the state level the something to start with and to carry, and see where we can go, because I do think there's an appetite for it. It's just not the way that it has been done before. And again, this is a great example of a community that I think has a tremendous amount of credit to say, here's how we'd like to do it. You've got your state resources, you got social impact bonds, and all kinds of different avenues that are out there. Here's how we'd like to set it up and give us a shot to prove how well it could work.
Yes.
Speaking of policy challenges, there are a couple of recommendations within the report calling for the state to require a lead inspection risk assessment at the time of leasing of a property or of sale of that property. Do you know if there have been any momentum or progress in those efforts?
So keep in mind that we wanted to put in this report what we thought it would take to completely eliminate lead poisoning, even if they were things that we thought were very, very steep climbs. So putting a requirement like that at the time of sale or transfer of property, I would consider that a very, very steep hill. But it's also an opportunity. It's a transaction that is already happening, right? It's an intervention opportunity. And so to consider that as a time to at least disclose to that new owner what the risks are, but hopefully you'd have the risks eliminated at that point, or eventually we'd have the type of system that could eliminate the risks at that point. That this is the sort of thing that I think over time is how you eliminate the risk altogether, is that every property eventually turns over. And so if you were to say that when it turns over, that's when this abatement work must be done, that would eliminate lead poisoning for the most part within a generation or so. But nevertheless, there are a lot of expenses at the time of the transfer of property, and the idea of adding on something else is something that I would expect there to be plenty of opposition to. So that's that in the category of a very aggressive recommendation that is extremely important, but would take it would take a lot of muscle to get through.
Yeah, and I would just encourage you and others to work with the realtors and other stakeholders. I think that there are probably many stakeholders that would like to see something like that happen, but would like to see it done in a way that doesn't hinder property transfers or make it more challenging for people to obtain housing when we already have another important issue there with housing in our community.
So the first place that some of them started was a disclosure requirement, because right now the way that disclosures work, even if there was a known lead hazard, the buyer wouldn't necessarily even know about it. And so to change how that works, that's something I think is relatively low-hanging fruit. So we've already started the discussions of policy change on sale disclosure requirements. But with that disclosure would come elimination of the risk, which is the part that naturally you would need to work with all the stakeholders, and we got to build the system that can handle it too. I mean, right now, if you could pass that law right now, and it just you wouldn't be able to sell properties anymore because there aren't enough people that do that type of work. So that's why I think, to be fair, we really do need to look at this comprehensive approach and all the different that happen to make that gold standard that we're all aspiring to feasible. So we've got to take the steps to build to make it so that that's possible to do.
Thank you.
There's a couple questions left. Do you have time for 2 more questions?
Sure.
Okay. Paul?
I think you just answered mine. I was
Okay.
just going to point out that some of these goals are very aspirational. So the tall climb, and it's those steps along the way. About a month ago at the board meeting, you spoke about just getting conditions ripe so that some of these things that are a tall challenge today may be seen as a smaller challenge.
Yeah, that's a philosophy that I've learned in my 10 years of working in state policy, that that getting wins together early in the process is important. So you get stakeholders together that we know that we might have a disagreement on an issue in the future, but what can we agree on now, and what can we get done and cross off this list right now? And then you build trust, you build rapport, you start getting wins together, people are feeling good about it. Okay, and then once you really start to understand things, you know that it's not, you might find out that, well, yeah, the reason I oppose this policy you're trying is because you got these other things that will make it hard to implement that policy. Okay, well, let's talk about then getting ahead of these issues in implementing or putting the systems in place that take care of those concerns of the future. So the more that we can do to reduce the objections or the reasons for the objections, the more success we're going to have on getting these aspirational goals that we've put out there.
Okay, one more question. I'm actually very interested because 49507 is in my ward, and we have in our community, we have really high rates of lead. So you had mentioned at some point early on in your presentation that ideally if we could assess every home, that would be, and obviously that would be very tough to do. But as I've been sitting here, I'm thinking about people who are going to homes regularly, and how do we equip them with the tools to be able to make the assessment, even if it's just the groundwork. So I think about postal workers going to homes every day to drop off mail. How could they be equipped with some other tool to be able to assess a property's, soil? And that may help us to be able to get this work done faster if we were to partner with other organizations. So using that example, I'm not exactly sure to what degree when you were saying assess address by address, you could kind of help me to learn a little bit more about what that meant. Maybe I can think of other stakeholders that
Yeah,
may be
great
interested.
question. I hadn't really thought about, people delivering mail as potential partners in this, and maybe there is a way to get some information there. But one of them that I think would be pretty could really be roped into to help, and it would kind of line up with the work they're doing, are assessors. So when it comes to overall condition of a house, on the assessment records, condition of paint, for example, is probably not something it's called out in the assessment report. They might have an overall kind of maintenance percentage or life of property percentage that they do, but maybe there's something that assessors could do. They don't go out to every property but there's just a regular process that happens, and so I think that's one group that maybe could be a part of it. And then a private sector entity would be utilities. I think that utilities have they have an interest in energy efficiency, and they also have, I know they're changing over a lot of the meters and things, but they have people that are out all the time, and so seeing areas where you have obvious windows that probably present a lead risk, and you have utility energy efficiency programs that could help with the replacement of windows, that's if the people maybe that are checking the meter could say, you know what, we should follow up with that address on energy efficiency subsidies, and maybe there's something that could be done. So, but that is, I would definitely encourage you to think in those terms, because if you try to just build a team that go out and do the work, then that's like a brand new thing, and that's the most expensive way, and it could be done that way. It's just that your resources won't go as far as if you can find people that are already out there doing something that could be utilized in this way. But any way that you look at it, there's definitely tremendous resource needs in this area, but that's all the more reason why utilizing every resource that you possibly get out there is is important to do, and then supplement it with the other opportunities like the CHIP grant. And hopefully overall better public health funding in this area over the long term. I mean, it's just something that I think in most places, maybe all places, that need exists. Just the capacity, the bandwidth to deal with all the population needs.
Thank you. All right, any additional questions? Okay, thank you so much for your time today. I really appreciate the time you spent with us and your insights and the efforts that you're making to help make our communities better.
It's great to be with you. Thanks for the invitation.
Thanks.
Thank you.
I'd like to make a comment.
All right, next item on the agenda, we have task force member comment, feedback. Any initial thoughts? I will kind of tell you where we're going in the next couple of months. August 16 meeting, that's our next meeting. We decided to have it back at the health department, and we thought that'd be a good place to kind of compile our recommendations and go through a list of what we'd like to recommend in our report and get all that put together. But before that meeting, Adam was gonna come up with a way for us to either like through a Google Forms or like a Survey Monkey type thing. I'm sure many of you have jotted down recommendations as our guests have spoken, things that have come up in your mind. We'd like to get a list of those and to compile a living document of, what we hope to put in our report and share with the public, at the end later this year. So between now and then, we'll get in touch with you guys and we'll give you a way to put those recommendations down either on paper, probably mostly like digital format. So next meeting will be at the health department on August 16th. And yeah, did you have anything to add to that at all?
No, that'll really fuel our conversation on the signal, categorize those according to different subject areas, and we start tackling them in a systematic way and start working on what we want to include as a draft set of recommendations going forward. And that will probably also fuel our conversations in the aftermath of that meeting on the 16th with some of those stakeholder groups so that we can see how these recommendations resonate with them and what else we need to consider for it as well.
So just a timeline of the next few months. So August we'll have our work session based on the recommendations. Possibly in September, we hope to hear from some stakeholders based on the recommendations that we have, how that would affect them, their concerns and thoughts. And then October, we hope to have a draft of our report. And then November, we hope to be able to disperse our final report and share that. And hopefully we can act on some of these items and continue to make our lead safe and eliminate it. So, yeah. Any thoughts?
Yeah, just one, and that is, if in fact we won't have a final draft of our report until November, I think we will have passed through a period of time for funding opportunities that may exist at present that may pass us by. I asked specifically about the CHIP because I wanted this group to hear, typically 60-day periods of response, sometimes even shorter than that. Mm-hmm. So how can we effectively build a plan but maintain our consistency with what the recommendations of the committee will be? And Paul and I sit on a more of a grassroots group addressing lead, and that was one of the things that came up at our last meeting, is we don't want to go racing off on a tangent and really start doing things that are not supported by the county's recommendations, because we think that those are so important. But I think that there's an opportunity, and sand is slipping through the hourglass. Mm-hmm. So I don't know what the best way of trying to handle that is. I would just hate like heck for us to miss out on an opportunity.
So I'd like to comment on that. Because the city has run a lead hazard control program since 2004 in the city of Grand Rapids. Knowing that this opportunity was coming up, we have been working with PCD staff, Paul's team and Adam's team in preparation for the release of this application. Just trying to get our arms around and head around how we could have a joint application. In the past, the city has been successful in getting a lot of federal grants for lead hazard control. But this would be our first attempt of doing this in a broader context for Kent County. And so we have some things in place at the city that can help us, I think, with a path, right, that has to be agreed upon everyone and hopefully meets the goals that we're trying to achieve, and Kent County commissioners and city commissioners for the city of Grand Rapids and those of Wyoming. But again, we have someplace to start. It just got released today, and I know in my office, I've got 3 people who are combing through it in detail because that's what we do. That's kind of what the Community Development Department does, is seek resources, federal, state, local. So they are already looking at it to figure out what programs we have in place in our community currently that we can build and what meets those requirements and what we might have to build as part of that. So there's a big conversation. It will require a lot of partners, but know that someone is starting to work on and look at that NOFA in detail already today.
Do we need to do anything before August 16th?
You know the deadline?
Do we need to do anything? What do you mean by do we need to do
No,
anything?
in other words, do we need to collectively have a conversation around, you know, what should that look like? Or are we going to wait until the August 16th meeting? And I hate to hold people's feet to the fire,
Right.
but
No, you're right, you're right to do so. I mean, because the drafts that we were seeing earlier, Matthew's gone, was that the proposal was to be released yesterday, came out today, so they're pretty much on the timeline. There was talk about the application needing to be submitted by mid to late August, so very, very quick turnaround. I think it was August 22nd, I think it was a date that was previously drafted. We haven't seen it's not published at the final detail today, but we're told it's coming out today on the Newswire, and it'll be posted to their website today, the specifics to this grant. We've already been able to start working on looking at the general application requirements. And then it was the hope in the draft that they would be able to make awards and begin securing contracts as soon as October 1st. So it's a super quick turnaround. I guess the 2 things. One is if you have thoughts about it, certainly communicate to Connie, I'll put Matthew on the spot, or myself, so that we can bring that to the team that's going to be responding. But also, I have a high confidence, just given our experience in working with the city of Grand Rapids on the lead hazard control grants, that the city does clearly recognize, taking the lead on this, that it does need partners. There are things that it does well, and there are things that its partners do better, and we'll always be looking out for those opportunities. It's easy for us to overlook something like that, so if you see something specific that could help, we would love to have that input.
So although it seems to be happening a little faster than our general timeline, I think, people are already proactive in, working on it. So we should be in good shape. Any other questions? Yes.
You had mentioned that we'll meet on the 16th. Hopefully we'll be able to conclude that day and formulating our recommendations. And then you said having stakeholders come to our September meeting to respond. So at the August meeting, are we going to have a list from staff indicating whom you believe are the stakeholders and your communications plan out to the stakeholders?
So I think the list that we generate and the ideas that we generate is going to determine who those stakeholders are and the sensitive points, if there are sensitive points that we think we need to translate, communicate with them about prior to moving forward. So really the next 27 days or so are going to be very important for us to capture all those ideas and then for us to have a good conversation within our group 16th so that then we can move forward with those conversations and figure out, do we need to have focus groups, and if so, with whom.
Anything else?
Just closing informational item. I have just a little quick sheet I put together to share with you where the State Commission is at in terms of some of its recommendations. You can take with you. That group has been meeting. It's gotten to the point where it's taken this big document. I remember when we all talked about this, 100 ideas, some of them, as the Lieutenant Governor said, extremely tall orders. And gone through a process led by Art Vandenberg over in Ottawa County, who's a member of the commission, to kind of prioritize which of these 100 plus aspirations might be prioritized. And so this list gives you a little bit of the background and the history of the meetings of the group. It does talk about that next year's budget does include $1.3 million to achieve the aims of the commission. And then there's a section on this page that starts with regulations and law and has some bullet points underneath. These are the aspirations from the initial report that the group seems to be prioritizing. My words, not theirs. Seems to be prioritizing right now for work in the coming months so that we might think about how we coordinate. But remember that these are aspirational. So like when you look at the first one, it's assessments before transfer or leasing of a pre-1978 home. The group does not think that's going to happen this year. It's what are the steps we need to take to begin down that pathway of that aspiration. That may be something that happens 5, 10, 15, whatever years from now. So, but this seems to be where they're starting to set their strategic direction. These are the pieces that they seem to be coming together around. So it takes this and makes it, 2 pages. Things may change as they continue to hold the next few meetings, and I'll be happy to update you in August and so on as things come into us.
Great. Anything else?
I appreciated that Lieutenant Governor Calley mentioned the capacity issue in terms of contractors, because in our local program that we have today, we are really struggling. And I'm sad that the media is gone, because it would have been a good opportunity to make sure that that message gets out there. So in the City of Grand Rapids program, we do have resources available, and we have partners are available as part of our strategy to actually train, to have contractors be trained in the lead abatement supervisor program and get certified. And so we really are looking for folks who are interested in that and have the resources to get them trained and certified as well. But we are really desperate in times like now with a productive construction economy. Federal programs in particular have a real difficult time in getting actors. And so we just met yesterday, my team, talking about a variety of strategies that we're getting ready to deploy to really try to go out and really find interested parties to get this training and figure out how we can support that happening, because we do have resources available. So we can create the pipeline of applicants and participants in the program, but if we can't do the work in the end, then we have a problem. So we're really working on that. So any suggestions that you may have to forward to me, I'd really appreciate it. We've basically are going to do anything and everything we can to get as many out there and trained as possible.
Yes.
Just one more comment. It just seems to me that it appears we're going to be looking very seriously at point of sale issues, and I want to just leave with the group some comments and thoughts pertaining to that. It wasn't long ago that the Rapids had a sidewalk inspection mandatory point of sale ordinance. That's not with us anymore. I think it's safe to say, I don't want to speak for them, but they found it rather ineffective. And essentially not a good way to attack the issue, because even though everybody thinks every home turns over at some point, so that's a good way to attack it, and that's when money changes hands, so that's the best way to attack it. It's really not the best way to attack it. The houses that turn over, there are those that turn over multiple times, and a great number of them that don't hard turn over, maybe 25, 30, 35 years. So it is not a good, broad-based approach to fixing a problem. If we believe that the risk assessment should be done on pre-78 homes, then we ought to identify all of those homes and identify how we're going to do that for all of those homes in a certain period of time, as opposed to the hunt and peck for those that happen to be transferring at any given moment. Not effective, not financially effective, not cost effective. When you have an inspector, especially if it becomes a requirement or a local requirement within the county, it's much less expensive to send an inspector out to do an entire street than it is to do this one on this street today and that one on that street tomorrow and then another one over 10 miles south. It is just so much less effective than doing something on a more broad-based level. Just my 2 cents.
Thank you. Anything else?
Emily, did you mention the length of the work session for next month? How long? Okay.
it could be a longer one, since we'll have more time for discussion, so, were we thinking like 3 hours?
3 hours.
So, can you schedule in like from 1 o'clock to 4 o'clock?
We start earlier?
That's a possibility too.
What's the question? What was the possibility? I could not hear that, I'm sorry.
Could we start earlier was the question. Well, people are already having a certain amount of time blocked. You mean earlier meaning lunchtime? 'Cause that would be
Sure.
noon.
Yeah, sure.
12 to
Put
3.
the brown bag there.
Yeah, just-
No.
That would be fine. If you want to start the meeting at 12 o'clock and plan to do it until about 3 o'clock at the health department on August 16th, we'll mark it on our calendars. All right, well, thank you so much for meeting with us today and listening. Some great thoughts and insight as we move forward. So our meeting's adjourned. We'll see you on August 16th.